doesn't have to be like, oh my god, I'm finally hitting there, it's the end of the world. No. I think that's when your second phase of life literally begins. Right? The walk and the talk is actually look at Kriana.
She's my secret weapon.
Okay. So I
I'm
think
sharing her with you guys. Thank you.
but I think this is quite funny because sometimes it's like when you talk about menopause, you're like, okay, which dwarf are you? Right? It's like
All of us. All of us.
So it's
No,
like
it's sweaty.
sweaty. And then, itch is actually one of quite a common symptoms because it's just not the itch, right? It's actually what we call it as the hives. The rash will come and will go. So that's also one of those. And then some of them, they have the symptoms of having this creepy, crawly sensation on the skin. That they keep thinking there's something there and then they keep doing this. So that's also one of it, right? So crawly sensation. But of course, this bloating and all that and forgetful, because forgetful, as I mentioned earlier on, is actually the estrogen, right? Okay. Yeah, so...
Estrogen, is that an increase in estrogen or is it too low?
Okay, so once when you menopause, it's all dropping.
So it's because of the lack of estrogen then?
But you know what, what happens is when you are in the transition, the perimenopause, we will have all this hormonal imbalance because the estrogen is going to spike. And a lot of women, they have high estrogen. So this is already like, you already know your perimenopause. It spikes, there's an imbalance, and it fluctuates, so the hormone fluctuates. So why does menopause happen? So it's just like any other hormone. So this, let's talk about the growth hormone. So once when you're 35 and above, every decade it drops by about at least 10%, if not 15%. This is just the natural, physiological, wear and tear, aging of human. And that's it. So when you talk about that, growth hormone is important because, muscles. So the other thing I'm going to emphasize is besides the hormones, once when you're already 45 and above, when you're already hitting 50, please at least do some form of exercise. But what is important is actually to build the muscles. So the resistant exercise comes in. So there's something called as muscle-centric medicine that, you can already predict a person's medical condition or health issues once the patient starts to lose muscles. So that's how important muscles are. The quality of life, everything is going to decrease once we start to lose muscles. And that happens naturally when you are 35 and above. So building the muscles are important, resistance exercise. So similarly, when you talk about the hormone that declines, that's also part and parcel of menopause. So when you talk about the estrogen, so this graph actually, if you look at it, it shows between the two, the estrogen and the progesterone, you see how the progesterone actually dips when you are already in your 30s. So this is the first hormone that declines quite rapidly compared to the estrogen. So most women are actually estrogen dominant. Now polycystic, progesterone and thyroid, they are also linked. So if you have low progesterone, you can have low thyroid. Or, stress is always the root of all evil. Okay? So this one just shows that progesterone dips. Estrogen, it will gradually, plateau. Right? And then I already mentioned just now, one of the causes of estrogen dominance, so that comes from your environment, liver, your gut health is also important. So progesterone, it's also impacted, as mentioned, the gut health, the liver function, the thyroid is also very important. Okay, so everything starts to decline. Now besides the female hormones, so testosterone is actually very important for women. We only require a small amount, but that small amount is very profound. So when you talk about the testosterone, it goes beyond the libido. It's actually for your muscles. It's for your bone health. It's important for your energy. Women, when you talk about the CEO level, they will always rub testosterone before they go into the board meeting because it makes them more assertive. Okay? On testosterone, about women. Okay, so before, you see, the thing is when you go for a certain meeting, you need to be very alert. So we are talking about the mental health, right? So testosterone is important. It makes a person assertive. Yeah. So that's one of the functions.
Take before the meeting.
I'm just giving you an example. What sort of when women actually take testosterone because they know it actually actually it benefits them.
I think we need that.
Because if you look at men, if you notice, right, testosterone for them, the first thing that impacts them is actually their mental health. They feel low, they feel depressed, they're not so assertive. It's like, when you talk about the focus also goes. So it's a lot to do with the mental health, more than just the libido. As I mentioned just now, so this is the similar, that not only the estrogen, the progesterone, but all the other hormones, including the melatonin, because you'll realize that sleep becomes an issue over time. Okay, so this one now we're going to zoom into the sexual health. So women, a lot of them, the first thing that actually goes is like the desire is low, and then the vagina becomes dry, and the ability to orgasm also decreases. Erectile dysfunction is for the men. So like how women undergo menopause, men they also go through the same. It's called andropause. It's just that they're in denial. So they're like, no, I'm fine. But they also go through it. So it's not something that is only for women. But I guess women gets a bit more complicated because we have more hormones. So more hormones, more button to press, and I guess so you have all these. So it affects everything. Right, so this is just the gist of just now what I mentioned, the functions of the estrogen, the progesterone, but we are going to focus now pretty much into the libido on the sex aspect. Okay. So what is vaginal atrophy? So this term is actually it's known as genitourinary syndrome of menopause. We all go through that. It's just that it has not been medically detected. So one of the clinical symptoms that a lot of women have is actually recurrent urinary tract infection. So they keep taking courses of antibiotic after antibiotic, and then they realize the guy is like something is not right. Then they go to a urologist, and then the urologist will do all sorts of tests, and then finally they say, you know what, you're fine. I think this is part and parcel of menopause. So there you go. So this is what happens. So what happens is the inner layer of the vagina, all the cells and all that, it becomes dry, it becomes thin, and then it gets inflamed. Especially when there's sexual intercourse, it's going to be very painful, and that is what that literally triggers UTI. So some of them, they may not even, symptoms are like UTI, but when you test the urine, they will say there's no bacteria. So it's not a full-blown like urinary tract infection, but what it's trying to say is it's actually you're dealing with vaginal atrophy. Okay? So, okay. I'm coming to that. I'm coming.
Just before you get that one.
Yeah. Okay, this is just before and after the environment of the vagina. So, ovaries, it produces estrogen, progesterone, and then if you look at it, right, the wall is thick. Okay, and then the mucosa is also moist. It's abundant of blood flow. Okay, and then there is elasticity so that, it can stretch. And also you have the fluid secreted during intercourse. Now what happens, menopause is like there's hardly any production of any estrogen from the ovaries, and then if you look at it, the walls becomes very thin, and then it becomes dry, and the elasticity is also lost. Okay, and then it becomes shorter. So all this will create complications when it comes to intimacy. Okay, so this one is actually very common, as more than 50% of women actually have this issue, but then it goes undiagnosed. And a lot of women, they tend to suffer in silence because they don't want to talk about it, they feel embarrassed about it. And yeah, so statistics shows that 47%, they actually wait for about 6 months before they seek any help, and then there's 28, they actually literally wait for about a year, and almost 50%, they don't even reach out for help. Okay, so as I mentioned earlier, these are all what happens is like, you tend to feel the dryness, the itchiness, the burning sensation, because a lot of women, like sometimes you don't even realize when you're sleeping, you're actually scratching, right? So when you talk about incontinence, it's actually also due to vaginal atrophy. Then UTI is one of it. And after all this, women just abstain from sexual activity with their partner. Okay, so what are the other causes besides just menopause, low in estrogen? So some women are actually treated with certain medications that reduces the estrogen level. Now, some of it is actually due to chemotherapy, you know, certain cancers, and then conditions like diabetes, if you have depression. So if you notice that, you know, you may have abundant amount of hormones in your body, you may have a balanced estrogen, progesterone, but if you have depression, especially for women, or even anxiety, or you know what, you're always in our head. So when they always say, whatever you have that is going on in your mind, your sexual life will just decrease. Yeah? Do you all agree with that?
They're all quiet.
Everybody's quiet. Do you all agree?
With what?
No, so if let's say you have a lot of issues, right? So whether you're anxious, you're depressed, I may give you a lot of whatever, balance your hormones, but then there'll be very small amount of them that will say that, you know what, I still cannot, you know, enjoy my sexual life. So that is something that is a lot to do with what's going on between your 2 ears. That means you're always in your head, you have certain issues.
Functioning for your
Correct. Yeah.
A lot of people find the, sorry to say, I come from Spain, so I don't know the culture here with the sexual intercourse, so I don't know how, but in Spain there is a saying that when people has relationship, they really release a lot of stress, and it's like a healthy thing to do when you are very stressed, so people take it like this, you know?
Absolutely.
It's actually true, I know, but I don't know how people will
Yeah.
take it into their daily lives, you know?
Yeah.
Everybody, how do you say, everybody deals with stress in a different way.
Correct.
But
Yeah.
in general, this is what our grandmothers tell us, you know, in the families, that something healthy is normal, you know?
Absolutely.
And also
So
the husbands around as well.
I think for the
I don't know that that's
True.
we don't need to tell them, they already know this one.
then there can be a battle in the
I might
bedroom
have to
then.
move to Spain.
Yeah. So actually, so there are like certain topics they talk about the benefits of orgasm. So coming to, you know, I'm going to be very open over here. So when you talk about all this sexual health and all that, it's actually the orgasm. So what you're referring to is actually when you release, like, you know, when you talk about orgasm, you have the endorphins and all that. So it calms the system, it calms the nerve. So that's when the benefits comes. Yeah.
Yeah, I think because we are not educated to be open about this. I don't know here, but in my country it's normal, right? Because normally even in the schools and all our aunties or our mothers, they talk to us about this like a normal thing. Sometimes you are talking to your friends and they tell you, that's all you need, yeah? That's basically how they talk to you and you're like,
So they're very open.
very
They're very open about it, yeah.
And it's true though, because it's natural, and that made us like this, right? And for the men, we know we don't need to teach them. They know how to release themselves in general thing, right?
Yeah,
For
I
us,
know
we
about
think
that.
it's I don't know, many taboos.
Yes, correct.
Many
Yeah.
taboos.
Yeah,
Absolutely. There's too many
I don't
taboos.
think it's taboo as such, because a lot of the teachers are the proper thing funny, where a woman has to please her husband and all sorts of
Yeah.
things, but it's, I learned from a dear friend of ours, she said, what happens between you and your husband, specifically in your bedroom, stays there.
Yes.
It